Imagine this. You're lying on an operating table. The room is silent except for the soft whirring of robotic arms hovering above you. No shaky surgeon's hands, no hesitation, just precision, down to the millimeter. Sounds like science fiction, right? Well, it's not. It's happening right now. In fact, celebrities like Ben Stiller, the Hollywood actor, publicly shared that his prostate cancer was treated with robotic-assisted surgery, and he called it life-saving. So here's the big question. Will robots replace doctors one day? Or are they just super expensive assistants? Let's dive into the fascinating world of robotic surgery, where machines become healers. By the way, don't panic. These robots don't come with Terminator sunglasses. At least not yet. Robotic surgery started in the 1980s with our machine doctors like Puma 650 or the Arthrobot. It was the late 1980s when NASA and the US Army imagined a future where soldiers could be operated on remotely, even from space. The first breakthrough? The Da Vinci surgical system, launched in 2000. Today, it's used in over 7 million surgeries worldwide. Think about that. A machine named after Leonardo da Vinci, the ultimate Renaissance genius, is now inside operating rooms, performing some of the most complex procedures known to medicine. Why Da Vinci? Because just like the artist painted with impossible precision, this robot can make tiny, perfect incisions where human hands might tremble. And no, it doesn't sketch the Mona Lisa inside your body. Just in case you were wondering, here's the fear part. Traditional surgery, scalpels, big cuts, long scars, came with big risks like infections, pain, and months of recovery. But robotic-assisted surgery? Tiny incisions, less blood loss, faster healing. Some patients walk the same day. Imagine your father needing heart surgery. Wouldn't you want the safest hands? Or in this case, the safest robotic arms? Operating on him. This isn't about replacing surgeons. It's about augmenting human skill with machine precision. And here's the kicker. Patients who once feared the knife are now demanding the robot. Let's clear up a myth. Robots don't decide how to cut you open like in a sci-fi movie. Surgeons control them, sitting at a console. Think of it like playing a high-stakes video game. The doctor moves joysticks, and the robot's hands translate those movements into ultra-precise actions inside the body. Here's the exciting part. The robot can rotate instruments in ways no human wrist can. We're talking 540 degrees of motion. Try that at home and you'll need surgery yourself. Here's where fear creeps back in. People ask, if robots are so good, do we even need surgeons anymore? Relax. Robots don't replace doctors. They extend them. It's the surgeon's brain and decision-making that guide the machine. But here's the urgency. As more people in Asia and the subcontinent face chronic diseases like cancer and obesity, demand for safe, minimally invasive surgery is exploding. And there simply aren't enough skilled surgeons. That's where robotics may become not just an option, but a necessity. Still, let's be honest. Would you trust a robot with your appendix? Or would you want the uncle who insists he can fix anything with duct tape? Interesting, right? Yeah, I thought so. Here's the conflict. Robotic surgery isn't cheap. One Da Vinci robot costs around $2 million, plus annual maintenance. For many hospitals in India, Pakistan, Bangladesh, or Nepal, that's more than the entire daily budget of a surgical department. So here's the real question. Are these miracles only for the rich? Or will innovation make them accessible to the masses? History shows us what starts expensive eventually becomes affordable. Remember when smartphones were a luxury? Now even a rickshaw driver has one. Robots in surgery might follow the same path. One of the most inspiring cases, a woman in her 30s with a brain tumor, too delicate for human hands. Robotic assistance allowed surgeons to remove it without damaging vital nerves. She walked out cancer-free. Another. In India, a robotic liver transplant was performed in 2023, making global headlines. Imagine a future where even complex transplants are safer because of machines. These aren't just success stories. They are glimpses of tomorrow's medicine. Now picture this. In 10 years, AI-powered robots diagnosing your illness, performing surgeries, and monitoring recovery, all without fatigue, ego, or human error. Scary? Yes. Exciting? Definitely. Some experts predict that autonomous robotic surgeries, where AI makes real-time decisions, may happen within 20 years. But will people trust a machine over a human? That may be the defining medical debate of our lifetime. Here's the twist. Asia is not just catching up, it's leading. Countries like India, China, and South Korea are developing low-cost robotic systems, aiming to democratize surgery. Imagine a rural hospital in Bihar or Sindh having access to robotic precision that was once limited to New York or London. That's the dream. Technology leveling the playing field. This is more than machines. It's about giving millions of people a chance at safer surgeries and longer lives. So will the machine doctor replace humans? The truth is, it won't. The future is a partnership. Human compassion plus robotic precision. And maybe that's the ultimate healing equation. Just imagine, someday you'll get a WhatsApp message from your surgeon. Robot is ready. See you on Tuesday at 9 a.m. P.S. Don't forget to bring your sense of humor. Next time you or someone you love faces surgery, don't just ask, "Who is my doctor?" Ask also, what machine stands beside them? Because the future of medicine isn't just in human hands, it's in the hands of machines guided by human hearts. And no, before you ask, the robot won't give you a discount on the bill. Not yet, anyway. Thanks for watching this incredible journey into the future of medicine. If you found this video inspiring, smart, or just plain fascinating, don't forget to like, subscribe, and hit that bell icon.